Hey there, hopping in live for the first time in a while. And I'm going to actually add my counterpart here, Naoya, because yay! Awesome. Hi, Naoya.
Hi,
I
Julie.
was just saying how we're running late because we just got out of an integrated treatment planning meeting, which is exactly what we were going to talk about today. And not only thank you for joining me for a quick bit at the end of the workday too. But I couldn't really talk about integrated treatment without having
An
more
integrated
than
team.
myself here, an
Right.
integrated team right here. We're going to integrate as we talk about the integration. And so just to give people like a quick background, this is we do integrated treatment programs for people with neurologic disorders. This has been a real evolution in our therapy practice at Re+active, particularly when we started Re+active, we had PT. It's called Re+active PT. We need to change our name because we're not just PT anymore. But we had PT, and then we had wellness services, and it was actually PT and wellness. And we integrated a lot between fitness and PT. Then we added OT, and we started integrating with PT and OT. Then we added psychology, and we started integrating PT, OT, psychology. We keep expanding that integrated team. And now we have made it to where we actually do an integrated program and we meet together every week and discuss together, get ideas from each of the disciplines. And I think to me, I told everybody actually as I just headed out of this meeting, I said, this is the favorite part, my favorite part of the job is to brainstorm, problem solve, and think about a person as a whole person and get that whole person perspective together. And that happens in those meetings. And honestly, Naoya, you're a big part of it. You led the meeting today. It was awesome. And so Naoya, I wonder, you've also worked outside of Re+active in an integrative clinic, right? In the team-based setting. And I'm wondering if you can just share a little bit about, how that experience comes into Re+active and what do you see as the difference with having that team approach?
Right. Yeah. I think that's a really good point, Julie. Thank you for sharing all those things. For me personally, I think what helps is to talk about like why we started doing an interdisciplinary or integrative care in the first place, right? So I was talking with one of the therapists here, and we were just talking about we had a lot of shared patients, but really complex shared patients, and we were both just feeling overwhelmed. Like we felt like we just weren't doing the best kind of OT, PT with the patient. So we talked about how can we make sure that we as a team feel supported and can do the best kind of therapy for our clients that are coming in, right? And so that's where the whole intensive interdisciplinary approach was really, I think we really jumped on that idea after that talk. But I think what I see is different about the interdisciplinary approach at Re+active is that it really feels like more of a transdisciplinary approach versus just a multi or interdisciplinary approach. In that I have been in other settings where I had multiple disciplines on the team, but we weren't necessarily starting therapy at the same time. We weren't necessarily meeting every week with a dedicated hour to talk about the case. And we weren't coordinating goals to the same level that we can with some of these interdisciplinary intensive programs. I think, Julie, like I agree with you in how the meetings are such a fun part of my day and such a big relief for me personally because I know I don't have to try to do everything for the client, right? Like there's no way that I can do it. I'm not qualified to do all these things, but to have someone on the team who can speak to that piece and do these great outcome measures, track progress, talk about treatments, talk about some of the things that I can do to reinforce carryover in my sessions. I think that's one of the biggest strengths that I see about this approach.
Yeah, absolutely. And I think, to me, we kind of all dove into this approach and we've been doing it over the last year. And I think the outcomes are pretty astounding too. And I think that's the thing where, you know, many people who come to us, because I think we're known for working with people with rare disorders or complex disorders, many people have come to us, they've actually seen a lot of different providers, right? And so they've seen APT over here at this point, or they saw a chiropractor here, or a functional medicine person here, and maybe an OT and maybe a psychologist. And all of those things were beneficial, but they never were all at the same time. And I love that you said, like, kind of beyond like a multidisciplinary, like we never even used that word for our team, because we wanted for ourselves and for our patient that, like, this is where that integrated approach kind of came in, that we're truly we're working towards the same goals. We're meeting every week to talk about, well, what did you see here, and how can I incorporate what you saw into my session, right? And I think it does go beyond just having different people here and you see them all individually. It's like truly like, let's figure this out, because most of the things that are complex take some figuring out. Let's figure it out together as a team, and let's like work with the person. They're the center of that team. Let's work with them to address it all at the same time. And then we've seen that, you know, we've shared stories of people who've been in this. Katie's story was one of them, of a person really being able to return to their life in a very rewarding way. And to me, that's the like, we could have fun, we could think this is great, the evidence could be good, but if it's not really helping the person get there, I would have to give up on it. But
Right.
I think it's been really rewarding to see that. But having just gotten out of a meeting now, I wonder if you could share just a little bit about that. I've had people ask, like, what are you doing, and how long does it take, and how does that work, and how does that really help a person? I wonder if you could share kind of what we do.
Yeah. So these meetings specifically, we've been doing it more intentionally for people who are coming in for intensives. And for intensives, what that looks like is people are getting all three disciplines, sometimes four actually. So PT, OT, psychology, and a wellness. So it could be a yoga therapist or a personal trainer. And so it's a set duration, right? So maybe 2 weeks, maybe 4 weeks. And during the those duration of the intensive program, we have weekly meetings. And we have a preparation meeting before the intensive starts, which I think is really, really crucial. This is when we start thinking about the case together. We start talking about what are some things that came up in the free consult or the application, who's going to be focusing on which parts, which like domains of the concerns that they have. We talk about outcome measures that we're going to use, so we're not duplicating them, that we're not missing anything, thinking that the other person's going to cover that. So there's that coordination that goes in even before the evaluation, which I find super helpful when I meet the person day one, because I know exactly what I have to focus on. And then during the program itself, we have weekly meetings talking about the progress. Usually it starts with just giving an update on how the sessions went to the other disciplines, which we kind of do during the week too, but it's a formal protected time to do that. And then we talk about, oftentimes we do a lot of problem solving. So maybe in physical therapy, they're working on this specific function, and maybe they're hitting a wall. We talk about what we saw in the OT, what worked, vice versa. I think a lot of times for me personally, having psychology on the team has been a huge change for me, because I have worked with physical therapists closely in the past, but with psychologists, not so much. But I think with psychology, having all these great phrases or concepts to reinforce in OT, in PT, that's really helpful. So those things come up in the meetings too, talking about, this week we talked about gratitude. This week we talked about acceptance and what that means and how that's different from giving up. And you can use these concepts in our sessions, right? And then the biggest part, I think, too, with these meetings is that towards the end of the intensive, we compile all the information that we gather during the intensive and the meeting, create a summary sheet for the patient that we just went through the intensive. And all that, like, good discussion that we have in these meetings are translated to something tangible for the patient to take home.
Yeah, yeah, exactly. And so, I mean, what I love too is in the midst, I've been out for a couple of weeks, but still like on the periphery of some of these intensives happening. And, every day there, and that's the other thing is like our team is supported with some extra time because this is a lot of communication. And I think that's what some other therapists have asked, like, when do you do this? And so we support our team with some extra administrative time for communicating, because literally in one of the intensives that's happening right now, daily, there's like, oh my gosh, she moved her fingers, and everybody's in there like cheering. And then it's like, then the next thing, then the next thing. Oh, and how did you do this? And how do you incorporate that? And even just little like updates and details. For me, being on the periphery of that one, it was so uplifting and supportive to hear kind of these little bits and pieces of progress as we were going and get people's insights as well. To get another very complex case that needed all of that. In fact, we instituted grand rounds today as well with our team, something we do every month. We brought that to the whole team and got even more ideas. I was like, oh my gosh, this is so amazing just to think that not only are the clients that we're working with getting the expertise of the person in front of them, it's literally like 20 people like helping. And I know for me, that is so rewarding, and also just feels so supportive.
Mm-hmm. Yeah, definitely. I think, Julia, like how you mentioned, there's that protected time, right? There's that additional support admin wise. I think that's been, that can add to so much stress. I feel like with a lot of my other cases too, where I don't have like a formal interdisciplinary meeting, you do end up kind of trying to find time, and it works out. We're making it work for sure. And the grand rounds too, that's definitely going to help a lot. But with these meetings that are set aside, like it feels so different. It feels like that's how every session should be done with the patients, right? Like I think it's really closer to when I learned about transdisciplinary care, when I learned about how people can collaborate to provide better quality care. I think this is kind of how I imagined it, right? Where you get to work with other experts on the same case, but and then like the piece about seeing these the wins, right? Like knowing that the patient's making progress in other ways, and sometimes you're only seeing one small corner of the case, and so you get lost. So you're not sure if they're making progress. But when you see the big picture and you're noticing there are psychology changes, their belief system changes, their movement changing, their legs is changing, their sensations changing, all those things help you build that big picture. And I think it helps with my direction too in the sessions, and knowing, okay, this is the right direction, or maybe this is something that we're missing. We got to focus on that in OT.
Yeah, yeah. And so, I mean, you kind of said it. I know you weren't trying to do a commercial for what's coming next at Re+active, but this is a direction that we really see our entire practice going into, is really having an integrated approach for all people. So this is something we're beta testing some things, we're taking some baby steps, but this is something that we really see as so beneficial. And the evidence supports it for sure, but it's not always practical and easy to do in our current healthcare system. Mm-hmm. So thanks to people like Naoya and the rest of our team to being really creative. Ryan just said the best team in the world. Thank you, Ryan. We're so lucky to collaborate with people like Ryan too in our community, that we see us doing this for everybody. Not just even for somebody who comes for an intensive bout, but shouldn't everybody have a whole team behind them and a really integrated approach to be seen as a whole person, to get back to their whole life, right? Not just their physical life, not just their occupations, but to the whole like physical, mental, spiritual, social self. that's kind of our pie in the sky. So we're heading that direction, to be continued. Now, oh yeah, I don't want to take any more of your time, so you can get home to your whole self tonight too. I just want to thank you for kind of hopping on here, for being a part of this amazing integrated team as well, but for sharing about it tonight too.
Yeah, of course, Julie.
All right, everyone, have a good night and happy Thanksgiving.
Bye.
Bye.